Back to Medical Dilemma. Before we start our discussion for the third segment, again, I would like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, Dr. Chung, earlier you were explaining about how you directly inject stem cells into the heart for heart conditions. Now, a follow-up question is, how exactly are the cells cultured?
Okay. So, firstly, there are different sources of stem cells. It can be sourced from our fat, like via lipoaspiration. It can be sourced from our bone marrow. We call it bone marrow aspiration. And it can be sourced from the heart. So, again, as I mentioned,
Also from the heart.
we could get stem cells from the heart. So these are the reserve army of the heart in case there's a trouble in our heart. These heart stem cells can be called upon to regenerate. But in our heart condition, maybe the condition is not permissive to allow them to grow. And therefore, it would require us to take these stem cells and culture it in our facility. So we culture it. We provide nutrients, growth factors, food, etc. Takes about 4 weeks to 8 weeks to grow them. We need to expand them. We need to produce certain number of stem cells before we could return it from the source. Or from the donor.
Yeah, that's why I think the facility is very important. The credibility, parang ano yan cooking place, no? May chef. Kung may infection or comes in, you destroy the whole thing. And it might be sayang because it's really expensive.
So all the while it's being cultured, it's contained in what kind of device?
Okay, so we have this thing called incubator. But the fancy thing about our facility, the air in our facility is being filtered 24/7. There's no room for error. There's no room for error in our facility because you cannot go back to the patient and ask for another sample of the heart. So we call it a cardiac biopsy. So cannot have that procedure redone. So the air is being filtered. We monitor the oxygen. We monitor the carbon dioxide. So everything is being checked on a periodic basis.
Now, maybe I'd like to bring back the discussion to an earlier point in time in the development of the technology. You mentioned in the 80s in the US, President George Bush banned embryonic stem cell research. What were the ethical issues that surrounded the research at that time?
Okay, so during that time, everyone is considering embryos as the source of the stem cell or the only source of the stem cell.
Because they allow abortion there and they get a very good source.
So there's
so the availability is there.
So there are sensitive issues surrounding the source of the stem cell.
Well, as a matter of fact, those source of stem cell, that's embryonic stem cell, do come from the excesses of in vitro fertilization. These excesses are supposed to be used, but they are already excess because probably in 1 or 2 or 3 trials, the third one probably may have already been successful.
Yes.
Then the rest are excess.
Discarded,
so they preserve it through a cryogenic process, refrigeration, and then because of so many of those in vitro fertilization or artificial insemination, for that matter, they multiply and multiply, they add and add, and that it would even come to 40,000, 50,000 a year embryos. Not only in the States, but also in England, for that matter.
In England.
So they are there for 5 years, 10 years, 15 years. How do you dispose of them? Knowing for a fact that there is a moral issue, many of these would not just dispose of them because they said, there is some sensitive issue, the moral issue, and in fact we moralists for that matter will say that an embryo is a complete human being.
Yes.
Taking with it a complete DNA, or complete chromosomes for that matter, because these are the ones that well, make up what a human being is all about. So an embryo, which is a fertilized ovum, is a complete human being.
Yes.
So if you use them, you kill them
Yeah.
in order to cure another. So there is some sensitive aspect there. Why do you have to kill someone in order
To
to cure
benefit
someone?
someone else.
So that's the reason why President Bush, because before President Bush, there were no legislations for that matter that
Ah.
control
Yes,
or that prohibit the use of embryo. So
Especially the excess ones.
especially the excess. They are not found wanting in those excess stem cells. There are so many of them because
Because
there is
abortion is allowed,
there is this,
yeah.
and there is that, etc. So there are so many of them. But came George Bush is a Republican, quite what you call this conservative. Well, stop. No federal funding.
Funding. Yeah.
But there are private facilities for that matter. They continued and continued. They just cannot get federal funding for that matter. They still continue, right up to now. They still
Until
do.
now.
But earlier, our guest said that if taken from the embryo, there might be more problems. What are these problems? Like
So,
maybe allergy,
Teratoma is
reaction?
a form of cancer.
Yes.
So these are things that we need to be careful with embryonic derived stem cells.
Ah, wow.
Versus adult stem cells, again, there's no report wherein they have alluded adult source of stem cells forming cancer,
Cancer.
or tumor.
Oh my gosh.
So this kind of stem cells seems to be the safer kind.
I would consider it to be the best.
The best.
Use
That's
your
good
own,
news for the
use your
Catholic
own stem
Church.
cell.
It's good news for us
Yeah.
because that has always been a thing that we have been fighting against, the use of embryonic stem cell. But the use of adult or somatic cells,
It's fine
no
with,
problem.
with
because they're
moral
adult,
teachings.
they can regenerate, get it from your own body, it can regenerate. That's it. You don't kill anything. You don't
Yes,
kill
yes.
anyone.
How long does...
Although that development still does not erase the moral issue
Oh, yes.
behind the excess use of
Right. Because
these embryos.
these are the raw materials.
no,
Very
not from
rich
the
raw
embryos.
materials.
Now they get it from their own. That's why. That's
Yes.
good.
So
That would be
Okay.
nice.
Oh yeah, it's very, very good news for us because before George Bush, well, this must be a new kind of ethnic cleansing.
Yeah, you know.
could be. Yeah?
Mm.
This
Could be.
crime against humanity. Just imagine how many millions of embryo, how many millions of human beings are being killed, and not most of them, or not many of them, are really a success. Only very few.
Yes.
That's
Even
why the
now.
sensitivity comes in, and so we have to fight. No embryonic stem cell.
There is no success data yet of the success rate of these things.
Well,
Um,
there's one study wherein in the US, they made use of embryonic stem cell in spinal cord injury. So they have shown in rats, after inducing spinal cord injury, rats were initially they had hard time walking. So after injecting the stem cell derived from embryonic stem cells, they started walking again.
I see.
But again,
is that the same for even if it's an adult source? I mean, would the same effect?
Well,
Kaya? What do you think?
there's one report wherein this patient who had spinal cord injury, so practically bound to a wheelchair, they sourced the stem cell from his nose, or we call it olfactory bulb,
From the
Okay.
nose.
Oh,
from
Yes,
the
yes,
nose,
yes.
and then they injected it back to him. And in fact, it was featured in another high-profile TV segment in the US, where a patient who had spinal cord injury started walking again.
How long is the interval, for example, from the injection to the time of that he's completely healed or something like that,
I
on
think
the road
it
to
only
recovery?
took less than a year. So
wow.
the recovery was really
Quite fast.
That's
really
good news
fast.
for the paralytics, among others, no? Especially those with injuries like that. They seem to be untreatable at the moment.
so there's no.
Yeah.
Now, the good news about stem cell, we always see its usefulness in some clinical indications wherein practically medical intervention has stopped there, or there are no alternatives.
No alternatives already.
So this is wherein the compassionate use of stem cell is being considered.
you
If-
know,
yeah,
yes.
go ahead,
Go
Dr.
ahead. I'm just follow.
Okay. Well, if stem cell therapy is considered to be very excellent way of curing diseases, why is it not still, the first line of medication?
Mhm.
Like in cancer cases, why do we still have chemotherapy and radiotherapy?
Okay, that's a good question. Now, for every standards of care,
Mhm.
it has to go through different phases. So it has to go through phase 1, phase 2, phase 3 clinical trials.
Mhm.
So how long does it take to develop a drug?
Right.
Normally, it takes about 10 years.
10 years, yes.
So 10 years to develop a drug. Now,
Mhm.
if you're a patient suffering from a cancer, most likely you don't have 10 years. You
Mhm.
don't have the luxury of time.
Yes.
And the difficulty here is, number one, you cannot offer a therapy that is still under investigational or experimental phase
Mm.
in lieu of the available standards of care.
Mhm.
So the logic dictates that you should exhaust all available standards of care
Right, right.
before you consider
As a matter
something.
of fact, it is an ethical
Experiment.
duty on your part.
Mm.
Standard therapies.
Oh, ethical duty on the part of the physician. But
Yes.
what if the patient believes that I don't
That's
want to
the
go
only
undergo
option
an
left,
operation?
yes.
I really might die during in the table or what? What if the patient really chooses as a first option stem cell therapy? What would you do, doctor? What are you advised to do?
Okay, so we created an ethics committee to oversee this type of scenario. So there are scenarios wherein a patient, a cancer patient, wherein the standards of care will do more harm than good. So surgery is not warranted because of pre-existing condition.
Right.
Too late na kuminsan, right? In the
If you have a
cancer
poor heart,
stage.
if you have a poor lungs, you cannot tolerate surgery.
Aha,
If you have a
yes.
poor kidney, you cannot tolerate chemotherapy. What will you do?
Mm-hmm.
So we have ethics committee to oversee this type of
Right.
conditions, whether or not it's warranted for this patient to avail or give him a chance for this type of therapy.
So the body ethics committee was just created precisely to sort of monitor internal monitoring
Internal.
in the
But,
hospital.
Which is
Within the
hospitals now
institution.
should have ethics committee.
Yeah, it's I think
Especially
required
big
by the
hospitals for that
DOH.
matter. And I think it is a directive from the DOH that all hospitals, for that matter, especially the tertiary, they should have bioethics committee. So at least, everybody is safe.
Mhm.
When it makes advice, etc., it means that what we are doing is within the ethical duty and within the ethical domain, that we are not actually doing any harm to the patient, but holistically we are trying to do everything for the well-being of the patient.
That's correct.
So how much longer do you think we will still take before we see this to be the standard of care?
To be
For the application of stem cell in the field of cardiology or heart, I think within our lifetime.
Within our lifetime?
Yeah, 5 to 10 years maybe. Yeah.
still
So
within
That's a
our
good news.
lifetime.
so we could start eating more meat. Steak.
So for the heart, huh?
Yeah, I think they are now under the last phase of trial.
Okay.
But these
so-
are for diseases, no?
For-
Existing diseases. But what if it's just to beautify yourself, or you have a scar and you're an actress, it's your line of work, and you have a scar on your face and you really want it removed? Do you think it will be all right? Did the DOH say so?
They are not clear on looking at aging as a form of a
Anti-aging.
disease.
Uh-huh.
So it's something that would require, I think, further discussion. Although these days there are some disorders that we never thought of that will be considered as a disease. So maybe later on
So
But-
I
it will
would-
be tackled.
Yeah, will it really work? Yeah, like make you look younger?
yeah, I've heard of some
No,
people.
again, so reversing of
The aging process.
of
At
aging
least
process
the
is
Not possible.
external
Yeah.
signs of aging.
But at least
internal.
the physical signs.
Physical signs, we have seen some people complaining about, we call it age-related symptoms.
That is with
So
your
when we age,
patients.
we have pain when we walk.
Right?
So if there's a technology can offer you reduced pain when you walk, then
Okay.
it's something that we need to consider.
Okay.
Although that's not an indication yet by the DOH, right?
Yes, it's not.
So what do you call that?
I
Like
see.
in drugs, we have what we call off-label drugs. In other words, if they were meant just to treat your headache, but you find out it's good for another, like treating your stomach, for example, of ulcers. I mean, will that be allowed? What do you think?
So it has to go through FDA approval process
Still, even if off-label.
of label.
That means off-label, father, you just get the consent of the patient, but you tell them that this is not a drug particularly for this purpose.
Mhm.
So that's it.
Well, talking about, for example, the aesthetics that you mentioned a while ago, remember the previous discussion that we have? And the procedures, or medical procedures, surgical, whatever,
Yes.
it should be, we must be able to choose whether it is a necessity,
Yeah.
a vanity, or insanity. So, those three things.
Yes. So,
Nice. I see. Okay, well, we have a few more minutes before we close the show, so maybe we can have some parting words from each one of us. Maybe we can start with Dr. Chung. Final
Okay.
words for the audience.
Well, for me, the technology is available, but just like any other technology, we need to be very careful with what we like to consider, especially it involves our health, our body. So I would strongly suggest that if you consider stem cell therapy, see to it that you're going to the right center. There is an existing system to determine whether you are the best candidate for this therapy.
for this
Okay,
kind.
thank you so much, Dr. Chung. Father Jerry?
Well, of course, we have to welcome this kind of therapy because it promises a lot of things. The only thing probably that we have to be careful about, well, the ethical aspect of it,
Yes.
and of course, we shun all things that, or all the kind of therapy that uses this embryo as raw material for stem cell.
Okay, thank you so much, Father. Dr. Sanchez.
You know, stem cell is relatively new, and personally, what I'm afraid of, and in using this, is that we know not enough of this stem cell. I'm afraid that it might like boomerang or become refractory in the long run. I mean, how often should you need this stem cell? And later on, it might become shorter and shorter,
Yes.
and then you need it later on every day. That's just what I'm afraid of, which I hope would not be.
Okay, thank you so much, Dr. Okay, while stem cell research presents a positive outlook for combating many illnesses, much remains to be done to make sure it is used correctly and, more importantly, ethically. Thank you for watching Medical Dilemma. Watch us again next Sunday, 6 p.m. here on GNN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you.